Hi, my name is Akhil Sood, reporting for Room Now. Today I have the pleasure of speaking with Dr. Melanie Hagen from Erlangen, discussing abstract 1537, which describes a new reported adverse event in patients who received CAR-T. Dr. Hagen, could you tell us a little bit more about LICATS?
Yeah, thank you for the invitation. So LICATS stands for Local Immune Cell Affected Toxicity Syndrome, and which means that we have observed a transient inflammation and worsening of symptoms of priorly affected organs in autoimmune disease that were treated with CD19 CAR T-cell therapy.
Oh, that's very interesting. And can you tell us about the onset of LICATS? When do you expect to see this adverse effect?
Yeah, so we had a median of 14 days. But referring to different organs, for example, patients with lupus nephritis showed an earlier onset of worsening of the creatinine or the proteinuria, earlier than, for example, skin manifestations who occurred at about 3 weeks after treatment. So maybe there's also a difference in the ability from the CAR T cells to migrate into the tissue in a different speed in different organs.
That's very interesting. And what would the management involve for LICATS?
Yeah, so we graded it referring to the treatment, and grade 1, for example, was just a watch and wait approach, so we didn't do exactly nothing and just be patient and brave and see what happens. And grade 2 were the use of steroids, only short term, and grade 3, for example, would be steroids and prolonged hospitalization. We only see that in 3 patients, and we defined grade 4 as ICU treatment, but there were no patients, fortunately, who were experiencing the grade 4 LICATS. So most of the time it's self-limiting and it's very mild.
That's really reassuring to hear. And have you seen similar reports of LICATS in oncology?
Yeah, that's a pretty good question. So when we did all the observations and did the research and literature, it's interesting because for lymphoma patients there were big trials reporting after CD19 CAR T cell therapy and then doing the follow-up PET-CT scan. They saw an increased uptake of the tracer in this lymphoma patient, and they were really afraid that this is progression or this is a secondary malignancy. And they did a lot of biopsies showing this is just inflammation or necrosis. And we have also performed biopsies showing that we see only inflammation, and we had no signs of the disease. For example, in the skin, we could not see immunocomplexes that were specific for lupus, because someone were afraid that these are relapses and not only a new adverse event that is self-limited.
That's really interesting. And should we be worried about this new reported adverse event in CAR-T?
No, totally not. As I mentioned, it's only mild and we can treat it very easily, even with doing nothing or just a short-term course of steroids. And on the other hand, it's very important to report it because we don't want to use unnecessary immunosuppressions in these patients.
Absolutely.
Because if you say, okay, it's a relapse and I want to treat that, I think that would be, it's not necessary. And I think that's the key point of the whole LICATS description, and we should report it in all the ongoing trials and state it like a new side effect. Absolutely.
And what would be some of the labs or parameters that we should use for monitoring of LICATS in the trials?
The labs?
Yes.
You mean if there was any correlation?
Some more in terms of the disease activity monitoring of LICATS.
Yeah, that's a good question. So, for example, in the lupus patients who then showed new or transient worsening of manifestations, we couldn't see any serological marker for that. Instead, they already were seroconverted and had normal complement levels, and they didn't see, we couldn't observe any increase of inflammation markers. So that's definitely also the difference between LICATS and a systemic inflammation like CRS.
Oh, that's really interesting. Thank you so much for sharing and discussing your abstract highlighting this new adverse effect that's been reported in CAR-T and discussing the management and manifestations. This is Akhil Sood reporting for Room Now. Thank you.
Thank you.